The Omicron variant of the COVID-19 virus is no longer breaking news. To discuss this variant of the COVID-19 virus, its nature, effects, and possible stigmatization of Africa by European countries and the West are Professor of Virology from the Premier University of Ibadan and a Special Advisor, University College Hospital. She is currently the head of the Department of Virology of the same University of Ibadan. She is also a member of several professional and academic bodies and has several publications in peer-reviewed journals all across the world. She is Professor GEORGINA NJIDEKA ODAIBO. Good afternoon. Welcome to the show. And finally, our last but not the least guest, he is the Director General of the Nigerian Center for Disease Control, NCDC, Dr. Ifedayo Adetifa. Doctor, good afternoon. Welcome. And most Africans and Nigerians are asking the same question. When is COVID-19 going away and what is the government doing about it? We just want to get our lives back.
Thank you for having me. Well, I am interested in the answer to that question as well, just like everybody else. But in terms of what we're doing about it, I know that there is pandemic fatigue and people are tired of dealing with COVID for the last almost 2 years now. But I think they need to keep an eye on the things that are being done. Yeah. Okay? So the government has advised and actually enacted rules for public health safety measures, which we are all supposed to adhere to, but we don't really adhere to them. Okay, the government has put in place efforts to massively roll out vaccination, including the more recent scale up in the vaccine campaign with the mass vaccination campaign exercise going on, including having stations all around in markets, in churches, and all of that. But the people are also not presenting themselves to ensure that we have enough needles in arms so that we can protect our population and protect each other. So the government has invested in preparedness and response. We can test, we can detect new variants, we can do all of that. But you know, when we get asked what is the government doing, I begin to wonder if there's anything else we should be doing that we are missing, because we're doing exactly what everybody else is doing, but we you know, rules, interventions, policies are only as good as the people uptake and adherence to safety recommendations.
Could you just break it down to the average Nigerian what this Omicron variant means and why they should not just relax?
Okay, so as I've said before, viruses or many of the bugs that cause disease in human beings, they change. They change in the course of reproducing. It's a matter of survival for the virus. The virus wants to survive, it wants to have more babies, and to do that, it needs to infect more people. Excuse me. Now, what happens when they go through reproduction is because that is still at a sort of more primitive level compared to human cells. Errors can happen in the genetic coding. Okay, now these errors can get carried forward into the next generation and persist if they confer some advantage onto the pathogen, in this case the SARS-CoV-2 virus. And sometimes what you get is they're either more transmissible, which means they can spread very quickly and in a shorter time than before, or in fact, sometimes they are more virulent, which means that they cause a more severe form of illness, or as one of the fears in this case is that they can escape protective immune responses, whether they were induced by natural infection or by vaccination. And some of these things happen. Now, for this variant, it's a lot of, we've got mutations or genetic changes in a number of areas on the virus that are responsible for infection, for virulence, and for possibly susceptibility to immune protection. Now, on the basis of those, even without waiting to see what happened, people were rightfully alarmed. Maybe not alarmed, they should rightfully cautious or concerned about that. And what you do when you're concerned is you try and gather information. You may take precautionary measures if you need to, but you wait till you have not completely stand still till you have all of the information, because if you wait till everything is perfect to act, then it will be too late. But you wait to get a bit of information and then you take some precautionary action while you do that. What we know clearly is For viruses to spread from one person to the other, it means that the transmission is unimpeded.
Yeah.
Okay? Now, in the case of SARS-CoV-2, if you do not adopt health safety measures, you do not use your mask, you do not wash your hands, you do not physically distance, then yes, you are aiding spreading of the virus when you get. And of course, if you do not vaccinate or take up vaccination as to the extent that you should, then you also would have a situation where this virus spreads unhindered. Okay. Now, the worry that this reminds us, just like we had for Delta, is as long as we have unmitigated virus transmission, we may have variants emerge. Now, a lot of other variants have emerged that have not made the news. People don't know that there's an Eta variant, there's a Kappa variant. There are other variants that have emerged.
This is breaking news.
Oh, yes, there are other variants that have emerged, but they do not meet the threshold or qualify to be labeled as a variant of concern, like has happened in this case.
All right. Now, as we said, for the average man on the street, I'm going to ask some questions like, an average person. Does this variant transmit faster than the original COVID-19 that we know?
It does.
Okay. Is it more dangerous than the COVID-19 that we know?
We do not know.
Okay. So do we have protection with the vaccines that we have at the moment? If we take this vaccine, are we protected from this one?
We have some protection. What the emerging information is that the protection against infection, that is just, may not be as good as with the virus that the vaccines were designed for, but even some of that can be overcome by giving extra doses of vaccination. Okay, so in Nigerian terms, at all, nine bad pass, it's better to have this one, at least you don't come up small, than somebody who hasn't had one at all. Absolutely.
Okay, so please continue.
Yeah, so you can see that part of the response in many parts of the world is to actually give more vaccine doses. Okay. It's an effort to boost antibody levels to a place where they can provide a bit more protection against infection. Okay. What we haven't seen yet is an increase in severity of illness, an increase in hospitalization and associated deaths. As far as I know, there is still no death announced with in a case that has the Omicron variant. And we still must take cognizance of the fact that the Delta variant is still actually quite prominent around the world. And we will need a few weeks to tease out whether the increase in cases is actually exclusively due to the Omicron variant or and replacement of the Delta, or actually it's just the end of year coincidence with winter in the northern hemisphere and with travel and all of the other related things in some parts of the south and everywhere actually related to the Yuletide.
Okay, this is another thing we're going to ask. People are very concerned about it when it comes to the vaccine issue. Can you talk to the average Nigerian on the street who feels that, okay, there's something nefarious behind the vaccine? Well, the government needs people alive to be able to work, pay taxes, and an income and grow our population. So it is not in the government interest to harm the people in any way. Can you communicate this to the people in some form?
Well, I think what people need to realize, unfortunately, is health is everything. Yeah. Okay. And COVID has shown us that it did not only endanger health, but it also has endangered livelihoods because we've not been able to carry on as normal. Travel has been affected. Investors have not been able to travel. Meetings have been cancelled. Tourism has been affected, all because of the fear of spread of this infection. So it is important to ensure that we go back to our normal lives and be economically productive, allow the country's economy to improve, basically allow all of our lives as we know it to continue. We have to get this bug under control. Now a pandemic is a once in a lifetime incident. Nobody alive has experienced a pandemic. So there are things that we do not know. I mean, this virus we have been at war with it for more than a year now. And we've done some very good things. I mean, the world came up with vaccines very quickly. Now, when I say very quickly, people think, oh, it was rushed. Yeah. It wasn't rushed. Okay, what people need to understand is the development of drugs, the development of vaccines and other things is informed by the amount of investment you put into it. Okay, if you leave a pharmaceutical company to develop a vaccine for a condition, they have to be able to see, okay, we're going to invest X amount. You know, we have shareholders that we're answerable to. We are hedging on this particular product and hoping that there will be a market for it. Okay. Okay. Now, what happened that accelerated development of vaccines for COVID is obviously it shut down the entire world. It did. It's killed millions of people. it's been a long time that you've had one condition kill so many people in a period of a year and shut down the entire globe in the way that it is, even if we're a bit lucky in this part of the world that we were not as affected as the other parts of the world in terms of health, but in terms of livelihoods were still damaged. Okay, so what people like the US government did is take away the risk element for pharmaceutical companies. It says, okay, you go develop us a product. If you have a product that works, we will buy everything that you produce.
Okay, so that helps. So this is not a matter of they skipped developmental stages. They did all the proper testing they were supposed to do, and eventually
but
gave the vaccine.
But think about it. We tend to, for reasons that I don't like, and we tend to sort of maybe believe in the quality of stuff of products made in other parts of the country. Is there any reason why we think that in the places where the vaccines develop, they will have cut corners to endanger their own population? It doesn't make sense. Yeah.
Okay, Professor Georgina, you just had some of the conversation we've had. Now, people on the street are wondering, vaccine, this new variant, should I care? Some people are like, listen, it's just, it's not serious. It's not an issue I should worry about. As a virologist, could you explain to us why we should keep taking all the safety measures and precautions that we've been asked to take, and what could happen if we begin to and relax and not take some of these measures?
Thank you very much. The issue about this virus is relatively new, so there's so much we don't know. But then, from the information we know about it, there are a lot of things that we should actually do from it. One of the information we know about the virus is that it has so many mutations. And the mutations could be to the detriment of the virus, or it could also be to the benefit. And if it's to the detriment of the virus, that means it's for the benefit of the host. If it's for the benefit of the virus, it is to the detriment of the host. So we actually do not know, one, what the level of severity of the disease that this virus is going to cause. And because we don't know that, there's need for us to take all the necessary precautions. All the necessary precautions. One thing that is also very clear that we know about the virus is its mode of transmission. Just like all the other SARS-CoV-2 strains, the mode of transmission has not changed. And the implication of that is that all the measures that we are supposed to be taking, all the non-pharmaceutical measures of wear your mask, wash your hand regularly, avoid gathering, maintain a physical distance with others, we should make sure that we continue to have that. So the fact that the virus has a lot of mutation is what is creating the fear. But then it shouldn't really be fear. We should just do what we should actually do.
All right.
From the information from the South African data, even though it's few, 42, at least there's some level of information that we can get from there, even though that can change any time from now. By the time the data is increasing, it could show that the virus is more pathogenic than the Delta or not.
Okay.
So we should just make sure we maintain and
those measures,
follow
and we
the
should be good.
Non-pharmaceutical, yes. And then now that the vaccines are available, there's really no need for fear. You know, just like the director has said, the DG, the government is not out to kill anybody. The vaccine is there for our own good. And we should all go out and take it. Though information also that's available has shown that
it's okay.
For the hospitalized individual, it's more among those who are not vaccinated. So that is an information that we need to push out there to the public so that people can really get themselves vaccinated.
Okay, so I'm going to talk about thank you very much. We're going to talk about the political aspect of it, the travel bans and all of that, which some have seen as completely political, something to do with, another form of apartheid and all of that. Now, the ban, did it follow the WHO processes and standards? Is this politics, or is this just countries just being careful? Should we be concerned? Should we be looking at retaliatory bans?
I'm a technician or better, I'm a technical person. I give technical advice, and there are others who may weigh in on other aspects related to implementation of any advice that I give from a technical perspective. But the WHO recommends a risk-based assessment and it to inform whatever travel advisories that you give. So suggest that you should use the science and use a properly done assessment of risk of transmission by either imported cases or your general population to inform some of your decisions. As I said before, we do also recognize that you can't wait for everything to be perfect before you make a move. Okay, but in terms of travel bans, I'm not entirely convinced that they were driven by the science. And I think, you don't need to be a technical person like me to know. As far as I can tell, for example, there are no country has instituted a travel ban that has, or red list that has the UK on it. The UK currently is probably only second to South Africa in terms of the number of Omicron cases that have been reported. I do not know that anybody has put the Netherlands on any travel ban yet. Yes, there were suggestions that they may have identified Omicron cases even before the South Africans did, but even with the other correction, all of that, it was still pretty around the same time the South Africans did. So, but we are still saying it came from South Africa, and because that's the headline that went out first and that now sticks. So, yes, I do not think, since all of the bans are looking in one part of the world, including in Southern African countries that had not even reported any cases, including places like Botswana, where their first cases appeared to be Europeans that actually came visiting. So it makes you wonder.
Let's get back to the Nigerian people. I'm going to ask you some questions like the average Nigerians. And so I don't want to take the vaccine. I mean, it doesn't work. So why should I take the vaccine? As the ordinary Nigerian, I believe it doesn't work. I believe all the talk they talked about many people dying, people did not die plenty. So why should I bother? I'm sure I can survive. We have the legendary African resistance to disease. Why should we bother?
Okay, so let's start with the latter point. There is, quote unquote, no legendary African resistance to disease. Okay, if there was any such thing, we would not be dying of yellow fever. We had large yellow fever outbreaks not too long ago in this country. Okay, and we had a vaccine available that protects against yellow fever, but unfortunately, we had enough people not taking it to create a susceptible pocket in the population for the virus to wreak havoc. Okay, we currently do not see tetanus, as especially in newborns, as commonly as it used to be when I was in medical school, because mothers are getting tetanus shots. And tetanus shots work because that is what they lead to. But we still had people, not just in Nigeria, religious groups and all of that, who suggested that this tetanus shots, because you had to give so many doses to pregnant women, was meant to, quote unquote, control fertility and all of that. So I believe this vaccine works because there's evidence from everywhere else. But let's stick with evidence here. We know now that when we looked at the numbers of deaths from hospitalized patients in October and November, that 81% of the people who died were those who were unvaccinated. Okay, only 3 and 4% of people who were partially or fully vaccinated died. And this is in a population of people who even had other problems. They were hypertensive, they had they had diabetes and all of that. So we know that the vaccine works. Whether it's from evidence from elsewhere, in terms of the numbers, or evidence from Nigeria.
So the proof is that it works.
Yes, and I am convinced that it works because I have taken the vaccine.
And you're still here.
And I'm still here, just like now more than 7 million Nigerians who have taken the vaccines.
And we're all still
and who are still standing. And I am actually looking forward to now going to go and take the booster dose. Just if it's going to help, and I know that it's safe, why not? I'll take it.
All right, that's good. So, Professor GEORGINA, would like your final thoughts before we go.
Okay, thank you. Yeah, on the issue of the vaccine and people not dying and people not becoming infected, we actually have information, even locally, that many people actually were infected with this virus. Many people actually were infected with the COVID-19 virus from studies that have been looked at the antibody produced by the virus. So we have evidence that people actually were infected. Many people were actually infected. So anybody thinking that the virus is not there, no. We may not have had the number of deaths as recorded in other countries, but then a lot of people were actually infected. And for the vaccine working, though it works, what we actually don't know for now is how long the antibody will last. Even for those who became naturally infected, how long does the antibody that is produced due to natural infection, how long does it last and how much does it protect? But please let us protect ourselves. You know, let's take the responsibility of protecting yourself.
All right.
You can say few people died, but only one death is 100% for that individual.
All right. Thank you very much, Professor. Thank you. Thank you for taking the time. It was good to have you on the show. Doctor, final words to Nigerians before you go.
Fellow Nigerians, you've heard the word. The virus is present here. It spread to the population exactly the way it has spread elsewhere. We have been lucky that we've not had as many severe deaths and severe hospitalization as elsewhere. But the emergence of this variant, which is now being found in Nigeria, and actually the emergence of previous variants that may have originated from Nigeria, is evidence of what can happen if we leave this virus to go on transmitting freely in our setting. Who knows what the next variant will be? Maybe that one will be really dangerous and lead to deaths and hospitalizations. The only way to protect you, protect me, protect your family, your colleagues, and fellow citizens is to adhere to public health safety measures. Mask use, physical distancing, hand washing, avoiding crowding and all of that. And then the other thing, of course, is please make use of every opportunity that is being provided to get vaccinated. Thank you very much.
All right. Thank you very much. It's been a pleasure having you on the show. And we look forward to having you subsequently, to talk about the successes with the Omicron variant as we've had with the original COVID-19 virus. It's been a pleasure.
Pleasure is all mine. Thank you.
All right. You can reach us on all our various social media handles, Lens and Africa at ntai@gmail.com, Lens and Africa NTAI on Facebook, Lens and Africa NTAI on Instagram. Our WhatsApp number is also available, so you can reach us at any time. Well, that's as much as we can take on today's episode. See you same time next week. From the producer, director, and the entire crew, have a good one.